Hi there, and thanks for joining me to talk about pain. And this episode will also be a video on YouTube, and I will be referring to my skeleton for some of this. So you may want to jump over to my YouTube channel to watch this. Otherwise, I will try to explain everything as well as I can. So if you're just listening, you'll understand what I'm talking about. Okay. So today I want to talk to you about chronic pain after rotator cuff repair. This is a very common problem because the shoulder system is a very complicated system. It's really unique in the body, and I'll explain why that is. And so it requires a unique understanding and solutions to solve a lot of this pain. Okay? So rotator cuff surgery is occurring because of a tear in usually, the supraspinatus muscle of the rotator cuff. And so the supraspinatus muscle, I've got my skeleton here, it starts at the medial border of the shoulder blade, the border that's closest to the spine, and it runs underneath this little tunnel that's formed by a weird part of the bone of the shoulder blade and the collarbone. It runs underneath there and inserts into the head of the arm bone at the top that's forming half of the shoulder joint. Okay? And so what happens is that will become torn. It could become torn because of a traumatic accident, or it could become torn because of a gradual degradation of the tissue. So a traumatic accident, usually these people who have fallen and they're younger or they're playing sports or something like that, they tear the rotator cuff, it gets repaired. These are the people that typically aren't developing chronic pain in the shoulder because they're young, they haven't set up poor movement habits yet, and it's due to some trauma. And simply we repair it and you're good to go. All right? The people who are experiencing more chronic rotator cuff pain are those that are maybe a little bit older, and maybe they have older problems like neck pain or elbow pain or wrist pain, or they were developing some tightness, or maybe they do a repetitive work activity that makes their arm move in one way for many hours a day, and they've been doing that for many days a week and weeks a year and many years. And so that's set up a tightness or weakness pattern that's contributing to the breakdown of that rotator cuff. Okay? Now, another thing that could be happening is that they have emotional or psychological trauma, and that could be manifested as tightness in the shoulder joint itself. Now, also, surgery is a traumatic event. So often people develop a trauma just based on having the surgery in and of itself, because your body sees the surgery or experiences the surgery as a significant traumatic event. I mean, they're putting holes in your shoulder, and they're repairing tissues, and no matter how microscopic that is, your brain is experiencing that as trauma. And so it could also, your body's response could be to tighten that whole system up too, to protect it. And so in these cases of more chronic exposure to degradation or breakdown or trauma or things like that, there's usually an element of tension in the whole shoulder system. And so that tension needs to be unraveled. However, most practitioners don't know how to address tension issues. Most of them believe it is a tightness issue and not a tension issue. Both issues result in a shortening, or what appears to be shortening of the tissues. So, your range of motion could be reduced, or any number of ranges of motion with the shoulder could be reduced. And so your therapist may see that as, oh, your muscles are short, we need to stretch you more. Well, they may be short though because of a tension issue in your body. And your brain is the thing that is creating that tension. So you can stretch those all you want, but if you don't teach your brain how to release the tension in the shoulder girdle system, then you're not going to have any long-lasting reduction of these issues. Okay? So I have learned over my career, one of the most powerful ways of doing this is something called Hanna somatics. And Thomas Hanna developed this technique whereby we're using the brain to actually reduce the tension in certain patterns of dysfunction. I have found this hugely powerful for my chronic pain patients, no matter where their chronic pain is. And I've included somatics lessons in all of my home programs that I sell to people who are experiencing chronic pain and can't seem to get rid of it. So that is one technique. You can find a somatics practitioner who will likely be able to help you unravel this chronic tension issue. Okay, so another thing I found is this idea of fascia. So fascia is connective tissue in the body, and it connects everything to everything. And there are superhighways of fascia that run from the head to the toe. I'm going to show, here's an image of a few of those pathways of fascia that run through the body. And so that anything, say, in the foot can affect things in the neck fascially. And here are a couple images of fascial lines that are in the upper body system too. There's an anterior line and there's a posterior line. So what this is showing is that it's connecting areas of the hand all the way into the head and neck. And so fascia is a really interesting tissue because it is contractile. And if there are areas of mechanical stress in the body, it lays down a different type of fascia called myofibroblasts, which have up to 4 times the contractile capacity of most other regular fascia. And so if your shoulder has broken down due to a gradual degradation of the joint, then it's likely that you have a higher degree of myofibroblasts in that shoulder system area than other people do. And so myofibroblasts are susceptible to trauma, anxiety, stress, any kind of insult that's occurring to the body, allergens, mold responses, anything like that causes the body to tense up in certain types of situations. So in you, having had that shoulder surgery, you may be experiencing that trauma that is releasing it. The way this happens is through a cytokine called transforming growth factor beta 1, which activates the myofibroblasts. So because of the trauma of the surgery or any other types of issues that you've had in the past, this could be releasing these cytokines that are causing the myofibroblasts to contract excessively, which is what's holding you back from getting the range of motion or strength that you need in your shoulder. So if this rings true to you, again, somatics is a great way of unraveling the tension aspect of this, and it will give you an opportunity to see, gosh, if I unravel this tension, how much better will my shoulder feel? And if it feels a lot better and stays that way for a little while, then you get to realize, oh gosh, tension is my issue. It's not because my muscles are just tight or weak, it's because my brain is generating this tension. And the somatics will interrupt that process temporarily until you fix the other biomechanical issues. So somatics is great for that too. But I wanted to talk to you about another thing that can help this. Is in my clinic, I had a class 4 laser. And laser therapy, I saw amazing results with class 4 lasers. And what I believe those results are due to is that the class 4 laser, one of the byproducts of using that laser is that it causes the body to produce nitric oxide. And so it causes that production to happen locally. Well, nitric oxide, it's been found in fascial research, relaxes fascial contraction. And so this is why I believe I saw, and sometimes extraordinary results using the laser for chronic pain problems. And it's a class 4 laser, not a lower class. I didn't have a class 3, so I can only comment on class 4s. But I worked with a lot of people who did have class 3s who didn't have results, but the class 4 was the game changer for them. So finding a practitioner with a class 4 laser and having them work on your shoulder and do a before and after test of your range of motion to see, it should be almost an immediate effect on the improvement in your range of motion. And the reason that that is helpful, I believe, is because the class 4 laser is causing the body to produce this nitric oxide locally, which is then causing the fascia to relax. And so that gives you a window to see, oh gosh, this is a fascia issue. If you just keep stretching, you're not going to change the fascial contraction part of the equation. All right? Lastly, I want to talk about your shoulder system and how it's working. Because what I've found is that most therapists, when they work with rotator cuff surgeries, are really concerned with, hey, can we get that arm up overhead and can we get that strength back? But they're less concerned with how that arm is getting up overhead. So the way the shoulder blade system works is that this shoulder blade should be assisting with the movement of the arm overhead. And it has a few rules that can be determined whether it's doing that or not. One is that as the arm is rotating up, the shoulder blade goes into action and elevates and rotates to help push the arm up, or at least support it during its overhead motions. Most therapists, though, are not measuring the degree of rotation of the shoulder blade or the elevation during these motions. And so if your shoulder blade is not moving, and again, those of you with chronic degradation of your shoulder blade, this is likely why it's happening, is because the shoulder blade hasn't been doing its job. It's only been the shoulder joint that's been absorbing all the stress. And so what most therapists don't seem to be doing is fixing the amount of upward rotation and elevation of the shoulder blade to assist with the arm movements overhead. And so what happens is, if this is supposed to move but it's not, you can imagine that then there's excessive breakdown and degradation of the shoulder joint itself, and it's bumping into the top of the shoulder bone prematurely and excessively because it's not being rotated out of the way like it should be. So you can go back to your therapist and ask them to assess your shoulder blade rotation. The upward rotation should be about 60 degrees. Usually if I can get people to 40 or 45 degrees, that eliminates their pain. And we should also see that the acromion here of the shoulder should be getting up to about cervical level 7 when the arm is raising up overhead. So have your therapist start working on the shoulder blade itself rather than just shoulder range of motion. Now, in my neck pain and headaches program that I've created, I show a technique that I developed to free up the shoulder blade, because what I found is, especially after surgeries, this whole shoulder blade system gets adhered down to the trunk and it can't move. Even if it moved before the surgery, it can't move after because all the muscles have gone into spasm and prevented it from moving. And again, if the therapist isn't keyed in on this, then they're just focused on range of motion, and that's never going to really solve the problem, which is why you're having chronic pain after shoulder rotator cuff surgery. I also have some taping techniques to help change the shoulder blade and how it works to see if this unloads the chronic issue in the shoulder joint. I also have a taping technique that replicates what the rotator cuff muscle does and unloads that tissue completely. Because if you're having chronic pain after a rotator cuff repair, it's likely meaning that the site of the repair is still undergoing excessive tension and stress and is in jeopardy of being broken down and re-tearing again. And so what that taping technique does is it reproduces what the rotator cuff does, and the tape is now doing what the rotator cuff does and allows all of that to calm down. So hopefully this gives you some ideas about why you're having chronic shoulder pain and what to do with it. It could be a fascial issue instead of just a range of motion issue. It could be a trauma issue that's resulting in neurological tension in the shoulder joint, for which Hanosomatics should help with both of those conditions. Let's see, class 4 laser can help relax the fascia. So finding a class 4 laser in your area could really help you. Having your therapist reassess the shoulder blade motion and mobilizing the shoulder blade could really free this up too. And my home programs with taping techniques, these techniques and other things to free up the shoulder system could also help. Because frankly, if your shoulder blade isn't recovering from rotator cuff surgery, ultimately that will likely play out in the neck and the head, causing chronic neck pain and headaches as well. And you know, you can see what that explanation is in my other videos in this podcast or You know, I've been on lots of other podcasts to explain this connection, but also if you end up purchasing my home program, going to rickolderman.com, I'll explain what these connections are and why they're happening, and my program will solve those for you. So hopefully that helps you move forward with this chronic shoulder pain issue, and I wish you the best of luck. Thanks for listening.